Awesome. So, Danielle, why don't you introduce yourself and we'll get this show on the road?
All right, sounds good. So my name is Dr. Danielle Samuels. I am a developmental psychologist. I'm specifically an adolescence researcher. I became fascinated in the phase of life that is this transition from childhood to adolescence. So we're not quite children anymore, not quite adults. That period has been lengthening over in modern history. So I studied adolescence, and I also was interested specifically in puberty. So when I was in graduate school, I started to become interested in the biological changes that happen during adolescence. These biological changes happen to everyone, but they happen in a social context in a very visible way. And so that got me thinking about the psychological experience of teenagers going through puberty and their changing bodies and their changing minds. And over time, I started to become interested in specifically what are some of the most visible signs of puberty and how might adolescents specifically react to those signs psychologically. So how will they experience them? Some visible changes of puberty, like the growth of body hair, are experienced as positive or negative, but there's some variability in how different teenagers react. One of the categories of changes, which is skin changes and acne, tend to be experienced more universally negatively, though there's some variability too, and that really piqued my attention. So then I was like, okay, I'm really interested in acne and what is the psychological experience of acne? So I wanted to dig into the literature and understand what had been discovered. And I realized that pretty quickly that the psychological literature was very scant in looking at this association between acne and really any skin disorders and people's psychological reactions. So that made me interested. And then I started to dig into the dermatological literature, and I found that some dermatologists had noticed this association between their patients with acne and increases in depression and anxiety. My first research into this topic was I wanted to establish a consensus. So I took all the literature that had been done, like I looked at all the data that had been collected on this topic, mostly from dermatological journals, and I did what's called a meta-analysis. And when I did that, I found that there are significant increases in depression and anxiety among individuals with acne in comparison with people that don't have acne, which was really interesting. And further, I had hypothesized that adolescents with acne would be the most depressed and anxious in comparison with adults. And so my first surprise as a researcher was that actually I found the strongest association between depression and anxiety among adults with acne. It's always fun to kind of be taken by surprise as a researcher. That's all a very long way of saying that that finding has then kind of propelled my research interest to dig into this question further of this association and why and how is it experienced and what are the mechanisms, how do we effectively address this issue, etc.
So I'm not a researcher, obviously, but I can personally speak to this a little bit because I've had pretty treatment resistant and very persistent acne for like half my life now. I'm 24 and I can safely say that I've had acne since like puberty, just like you said. And when it was me going through the early stages of my life of middle school, high school, even college, I was thinking like, oh, this is a phase of my life, it'll pass. I'm just going through so many hormones and changes and bodily experiences, like this is all part of it. But then just like your findings have shown, like as you enter early adulthood, as I started to, get a real job and have a 401k and contribute to it, it stopped feeling like something that was a phase of my life. It started feeling like part of my identity. Granted, I didn't have any sort of like depression or anxiety with it. For me to realize that it was starting to become part of me, that's when I really took the extreme measures and saying like, okay, maybe it's time for me to try Accutane.
Yeah. I think that is such a common experience, Kelly. And what you're describing is that you weren't diagnosed with a clinical depression or anxiety, but that's still, there's a whole spectrum when we think about feelings of distress. And psychological distress associated with acne is quite high. and it doesn't need to reach a clinical level in order for it to affect someone's life and the way that they move through the world. So every semester at University of Massachusetts in Amherst, I would teach an adolescent psychology class to my college students. They're mostly juniors and seniors, so early 20s. And I would have one assignment where I would kind of poll the class, and these were classes about 300 students, so quite a large sample. And I would always ask them about their experience of acne, both as an adolescent and then currently today. And I started to become really interested in how their responses were corresponding to the research that I had done, which is that many of them were still experiencing acne either since adolescence or actually had started experiencing acne in their late teens and early 20s when they hadn't experienced it earlier on, and found it quite distressing, and also found that in general it wasn't always taken seriously as something that is a viable cause of distress. And so this became very interesting to me. And when you think about it though, from a developmental perspective, so when you're a teenager or when you're an adolescent, about 85% to 90% of adolescents will have acne at some point. So it's almost a universal experience. And so while it can be really distressing, it also is, if you look around your middle school classroom, the chances are that you will see many other students that are experiencing acne as well. And then as we get older, while acne actually is on the rise in some cases in adult populations, there's less of an incidence of acne in adults compared with adolescents. So as adults get older, if you look around, let's say the meeting room at work, the chances are lower that you're going to see a colleague with acne. One other person the chances are lower. And so because of that feeling of being kind of out of step with your peers, we think that that's one of the reasons why adults who experience acne feel distressed by it, particularly distressed.
So we've talked a lot about, of course, your research and your findings of people who have acne. Why do you think that it's so dismissed, having acne and the mental pressures of having acne is so dismissed by people who don't have it or have never experienced acne?
Okay, so this is a great question, and there's actually a lot of depth to this question because for a long time, even early medical professionals kind of dismissed acne as even being worth treating. It was really not until the early 19th century that there were two kind of founding psychologists, William and Bateman, who began to take acne seriously as a condition that would be worthy of treating. And part of the reason for that is that acne has been so consistently dismissed in terms of it is not as urgent of a medical concern as certain other diseases and disorders. And so for that reason, it was kind of seen as, oh, well, it's spots on your face, but no serious doctor isn't going to treat that, much less think of it in a psychological context. And so I think that is the crux of the reason why it has been kind of dismissed over time. However, we also know as psychologists that a heightened visibility of acne and really anything on your face has a lot of psychological weight. And so as opposed to other parts of your body that you can really easily cover up, you can't cover up your face. And if there is something that you're carrying around on your face that you don't want to be carrying around on your face but can't control, then that's extremely psychologically distressing. And so that's one of the reasons why we think that acne can be both dismissed but also deserves to be attended to in terms of its psychological weight.
Absolutely. And honestly, I should have started with this question, but I would love to hear if you have had any personal experiences with acne, and I want to hear about that.
Yeah, as a teenager, I started getting acne. I had acne on my forehead, and I don't know if it was treatment resistant, but it certainly was persistent. And I remember that lack of feeling of control over kind of no matter what I do, I'm carrying this around on my face. And I remember it being a very stressful experience and being really, really happy when also for unknown reasons it cleared. And so, but I've never forgotten that kind of feeling of a lack of control and not knowing what I was going to get in the morning, and then kind of walking around like that. And I think I would probably, if I'm honest, say that I was one of those kids that even if it was one pimple, I was like, everyone's looking at my pimple as I walk around. And I mean, I'm still like that. And that gives me a lot of empathy for this topic specifically. And that's an interesting actually aspect of this research too, is that sometimes the clinical assessment of the severity of acne doesn't correspond necessarily to a person's own perception of the severity of their acne. So there are some folks who are clinically assessed by a dermatologist as having very severe acne, but might be less psychologically concerned about it than another person who has more mild acne, but is finding it very distressing personally. So there needs to be an attention to how the person is experiencing it and not just whether it's clinically severe or not. Does that make sense?
Absolutely. And of course, I asked this because there had to be some sort of catalyst for you to want to delve into this as a profession, right?
Yeah, I love a good mystery. So that kind of scratches the itch in my researcher brain, but also as I dug into this more and more and talked to people and reflected on my own experiences, I realized that there's a lot here. And there's this whole silent group that's kind of waiting for their stories to be told and to be understood.
Perfect. So what has your research shown about the connection of like acne and maybe the process of removing acne, such as a process through like Accutane, for example, and that of anxiety and depression and other mental health struggles?
Yeah. And that is a logical direction in, once we establish that there is a robust association between the condition of acne and increases in depression and anxiety, we're like, okay, what do we do about it? Because that's interesting, but moving to a solution and alleviating human suffering is more interesting. So in consultation with dermatologists and also in consultation with individuals with acne, one of the most important steps is if an individual wishes to, that they have access to effective treatments for acne. So not everyone with acne has to treat, but if they want to, it's important to have access to effective treatments. For example, Accutane. And the thing about Accutane though, is that there is in the US somewhat of a stigma of a purported association between Accutane and depression. So it's cast under some suspicion as being associated with depression. When we look at the available evidence, though, this association isn't supported. There has not been a causal link demonstrated between Accutane and depression. In 2017, researchers did a meta-analysis looking at all the research of the mental health outcomes of individuals on Accutane, and they did not find any statistically significant association between Accutane and mental health problems like depression. We also know that given the association between acne and depression and anxiety, it makes sense that other studies have found actually a decrease in depression following effective treatment of acne. So that another way of saying that is that when someone has found a treatment like Accutane that works and clears their acne, we see some alleviation in depression. And there's some studies that have shown that. So it makes sense, given that we know acne is a psychological risk factor, that clearing the acne can alleviate some of the psychological suffering. So that's what the research says. And that's also been corroborated by anecdotal evidence and qualitative research. My anecdotal evidence is what some of my students talk about, and kind of they describe life-changing effects of their acne clearing, either by time or by treatment, and through their recollections of their teenage years and their current experiences. So that kind of sums up the state of affairs in that area.
So my last question, and these are some closing thoughts as well, what would you say are some possible tips or techniques that you can give to people when it comes to having chronic acne, but trying to stay positive through the experience, whether they're on Accutane or not on Accutane?
Mm-hmm. Well, this is one of my favorite questions that I ask my students, actually, because I love to get their own ideas for solutions and ways that, especially many of them are on I'd say most or all, are on social media. I like to think of ways or hear their thoughts on ways that social media can be used for good. And one of those responses that they consistently give me is using social media as a platform for destigmatizing or normalizing acne, just portraying real photos of real faces, using less filters. So my first answer falls under the broad heading of destigmatization, which also makes sense because the weird thing about the stigma against acne is that it is a very widespread experience. It's kind of at odds with, there's a stigma against something that is quite a shared experience among humans. And almost all of us know what it's like to wake up with a pimple, to experience acne. And so normalizing acne might be a powerful agent in its destigmatization and in its incorporation into different cultural narratives of what is beautiful and what is worthy. And there seems to be some positive movement in that direction. So I would say to those who are suffering with acne, who are experiencing suffering in association with their acne, there's a lot of power in feeling less alone and feeling like there are other people that are experiencing what you're experiencing, and social media can be used for good in that. And there are also narratives in social media that are toxic to that kind of understanding, but we have all forms, and so kind of pushing both narratives is helpful. I think that answers your question.
Yeah, absolutely. That is a really great response, and I feel like I agree with you. Had I still have acne, or like back when I did have acne, if people could stop stigmatizing something that's so ubiquitous to everybody and everywhere on earth, like that would be so good. But of course, I know we're taking the steps to get there, and utilizing social media to get there is a great first step. So I won't take up too much more of your time. Do you have any last thoughts or things that you would like to impart on our audience?
I think that we are in a moment of a lot of individual control and agency. There's a lot of options, both for deciding to treat and not to treat, and there's a lot of information out there. And so I think informing yourself, talking to people, and so I encourage people to talk to each other and to also seek out advice from experts, or at least people that are kind of doing innovative work in this area. I think my main message is that don't lose hope, and there is a solution, and you have the tools to find it.
All right. Well, thank you so much, Danielle, for taking the time. I'm so happy that we got to sit down and chat, and I'll keep you updated on the next steps.